Hello. I'm going to share 3 real-life stories. Ability to speak and walk. That's what happened to Anna, 30 years old, who had just given birth to her baby 5 days ago. While breastfeeding, Anna began to feel dizzy. She tried to stand up but couldn't. Her legs felt weak, so she decided to call her husband. He quickly noticed her speech was slurred, something wasn't right, and he rushed home. Without delay, he took Anna to the nearest hospital. Upon arrival, she was immediately attended to in the emergency room, where doctors performed a CT scan and identified the problem. They promptly administered a thrombolytic medication intravenously. The effect was almost magical. Within moments, Anna regained both her speech and the strength in her legs, and the dizziness completely vanished. Quick action was crucial to prevent more severe consequences and ensure her full recovery. Case 2. This story involves a 65-year-old man, an engineer named Paulo. Paulo was stressed due to credit card debts and family problems. He was overworking, losing sleep, living life on autopilot. He never had time to take care of his health. He was obese, diabetic, and hypertensive, all poorly managed. On a Friday night at 3 a.m., while leaning over his computer, he felt a severe headache. It was so intense that he immediately knew something was seriously wrong. He called his brother, who was a nurse, and soon passed out. He only woke up a week later in the ICU. He had undergone surgery, and the doctors had just stopped the sedation from the induced coma. Case 3. Another woman, 55 years old, named Sarah. Sarah suffered from arrhythmias, but it had been a few years since she last visited her cardiologist. On Christmas, she was celebrating with her family when she began to feel tingling in her face. Her mother quickly noticed that her mouth was crooked, and Sarah ran to look in the mirror. She was promptly taken to the hospital, but on the way there, to her surprise and relief, her mouth returned to normal, and the tingling subsided. Even so, she was hospitalized after undergoing an MRI. What do these 3 cases have in common? All 3 had a stroke. Today's video covers a very important topic. In this content, you'll learn how to recognize the main signs and symptoms of a stroke. If you want to protect yourself or your loved ones from a disease that can cause serious long-term effects, stay with us until the end. I have valuable information you don't know yet. But before we continue, make sure to like the video and subscribe to the channel if you haven't already. Don't forget to turn on the bell to receive all notifications. Share this video with your friends and family. I'm sure many people will be interested in the topic. And tell me, have you ever had a stroke, or do you know someone who has? Share your experience in the comments. A stroke can happen to anyone, including young and seemingly healthy individuals. And the most alarming part is that many people don't know how to recognize the signs and symptoms in time. Let's understand. What is a stroke? A stroke is a medical emergency because the blood pumped by the heart is unable to reach a part of the brain. And what happens when blood doesn't reach that area? That part of the brain becomes deprived of oxygen and nutrients, leading to the death of thousands of neurons every second. Every minute makes a difference, every second counts. In the past, when a person with a stroke arrived at the emergency room, the treatment options were limited. A CT scan was performed, and in the absence of bleeding, aspirin was administered, and the outcome was awaited. Today, the reality is quite different. There are effective medications to dissolve the clot and recover much of the brain function. In addition, there are procedures that can open the affected arteries. Miraculous cases have been observed, where patients arrived at the emergency room unable to speak, unable to walk, and after the medication infusion, they started speaking clearly, shook hands with strength, and had their dizziness relieved instantly as if by magic. If you or a family member starts showing the symptoms I'll mention shortly, don't waste time hoping the symptoms will improve on their own. Don't do that. Take the person immediately to the emergency room. Let me emphasize, every minute that passes is a part of the brain you're losing. Time is critical. The quicker you get to the hospital, the faster the doctor can start treatment, whether with medication or even performing a procedure like catheterization to unblock the affected artery in the brain, or even remove the clot. This action can be decisive in preserving memories, motor skills, speech, the ability to recognize objects, and, above all, can save lives. Now, let's talk about the signs your body gives when you're having a stroke, and you need to be familiar with them and prepared to identify them quickly. Remember the cases I mentioned. Sudden difficulty speaking or dizziness. Loss of motor coordination or imbalance. Severe and sudden headache. The worst headache the person has ever felt. Numbness or tingling in one arm, leg, or one side of the body. Weakness in the face, arm, or leg, especially on one side of the body. Difficulty speaking clearly or understanding what is being said. Sudden confusion. Vision problems in one or both eyes. Fainting. If you're with someone who was fine and suddenly starts showing any of these symptoms, the first thing to consider almost immediately is a stroke. Now you will learn a very effective tool that can help identify a stroke quickly. Follow the steps below. Smile. Ask the person to smile and observe if the smile is balanced. If one side of the mouth droops or doesn't move, it could be a warning sign that something is wrong. Hug. Ask the person to raise both arms or try to give you a hug. If one arm feels heavier, weaker, or is unable to lift, this is concerning and should not be ignored. Music. Ask the person to sing a song or repeat a simple phrase. If their voice is slurred, has difficulty forming words, or sounds distorted, this is also a warning sign. If you notice any of these signs, don't waste time. Act immediately. Call emergency services or go to the nearest hospital as quickly as possible. Why can a stroke cause such varied symptoms? Why can one person have difficulty speaking and quickly return to normal, while another may be left with lifelong disabilities? The answer lies in the complexity of the brain, the most intricate organ in our body. The symptoms depend on the area of the brain where blood flow has been interrupted. For example, in most people, the center responsible for speech is located in the left half of the brain. Therefore, a stroke affecting the left hemisphere can lead to difficulty speaking and understanding, as well as weakness or paralysis on the right side of the body. On the other hand, a stroke in the right hemisphere would affect the left side, causing weakness or paralysis in that area. A stroke can also lead to difficulties in identifying or locating body parts, as well as affecting memory and altering personality or behavior. If it occurs in the cerebellum, it can cause problems with balance, coordination, dizziness, nausea, and even vomiting. In the brainstem, it may result in the loss of the brain's ability to control vital functions such as breathing, blood pressure, and swallowing. The main factors contributing to the risk of a stroke are many, but the most important, without a doubt, is high blood pressure. It is a critical factor for both ischemic and hemorrhagic strokes. Therefore, if you have high blood pressure, it is essential to manage it properly. Another important factor is smoking, which can not only cause brain aneurysms but also increases the risk of thrombosis and clot formation. Heart problems such as an enlarged heart or heart valve diseases can promote the formation of clots that break loose and reach the brain. Diabetes also increases the risk of stroke by 2 to 4 times, as does alcoholism, which can cause hypertension, arrhythmia, and heart muscle problems. High cholesterol can form plaques in the carotid and cerebral arteries, obstructing blood flow. Obesity is another important factor, as excess weight harms the circulatory system. Additionally, a sedentary lifestyle, poor diet high in salt, fat, and low in fruits, and the use of illicit substances are other aggravating factors. If someone in your family has had a stroke, especially of the hemorrhagic type, it's important to check if you have an aneurysm that could be about to rupture. The increase in strokes among young people has become an alarming concern. Risk factors such as high blood pressure, diabetes, high cholesterol, obesity, sedentary lifestyle, and heart arrhythmias, which were once more common in older adults, are increasingly present in younger populations. Take a moment to reflect. How many young people do you know who are facing these issues? Personally, I see this growing in my practice. This trend is worrying because young people are often the primary breadwinners for their families. A stroke can be devastating, significantly impacting their lives, either preventing them from working or leaving them with limitations that affect their quality of life. The treatment for a stroke varies depending on its type, which can be ischemic or hemorrhagic. There are 2 main stages. The first is to stop the stroke while it is happening, and the second is to address the aftereffects and prevent future episodes. In the case of ischemic stroke, advancements over the past 20 years have been remarkable. One of the most common treatments is the use of thrombolytics, administered intravenously, which helps dissolve the clot. However, time is critical. The medication can only be administered within 4.5 hours of symptom onset, although this window can be extended in some cases. Another option is thrombectomy or embolectomy, a procedure in which a thin catheter is inserted into the brain to remove or suction the clot. When the stroke is hemorrhagic, if the bleeding is extensive and the patient is in a coma or drowsy, neurosurgery may be required. The surgery aims to address vascular issues, such as aneurysms and arteriovenous malformations, drain hematomas, and reduce intracranial pressure. Strict blood pressure control is also essential, as it can help prevent further bleeding. Now, speaking of prevention, the key is to reduce risk factors. Keeping blood pressure under control, avoiding smoking, managing diabetes, adopting a healthy diet rich in fruits, vegetables, and whole grains, maintaining cholesterol levels within ideal ranges, and engaging in regular physical activity are crucial habits. If you are overweight or obese, working towards weight loss will also help lower your risk. The message is clear. The more you manage your risk factors, the lower your chances of having a stroke. How about you? Are you already taking steps to prevent a stroke? If you found this video helpful, share it with your friends and family. Together, we can raise awareness about this important topic. And don't forget to subscribe so you don't miss the next videos. See you next time.